An anal abscess, also referred to as a perianal abscess, is essentially a painful lump filled with pus that develops near or in the anus. Think of it as an infection that forms in the soft tissues around the anal area. It occurs when one of the small glands located inside the anus becomes infected and filled with pus. These glands normally produce mucus that helps with bowel movements, but when they get blocked or infected, an abscess can form. Anal abscesses are more common than you might think. They affect about 100,000 people per year in the United States alone. Men are more likely to develop them than women, with the condition being most common in people between ages 20 and 40. People with certain medical conditions, like diabetes or inflammatory bowel disease, are at higher risk. Causes of anal abscess. The primary cause of an anal abscess is usually bacteria getting trapped in one of the small anal glands. This can happen when the gland becomes blocked, often due to stool particles or other debris. Once blocked, bacteria can multiply, leading to infection and abscess formation. Other causes include: number 1. Anal fissures. A tear or crack in the lining of the anus can create an entry point for bacteria, leading to infection and the formation of an abscess. Number 2. Crohn's disease and ulcerative colitis. These inflammatory bowel diseases can increase the risk of developing anal abscesses due to chronic inflammation and tissue damage. Number 3. Trauma. Any injury to the anal area, including from surgery or anal intercourse, can introduce bacteria and lead to infection. Number 4. A weakened immune system. Conditions such as diabetes, HIV or AIDS, or chemotherapy treatment can make individuals more susceptible to infections, including abscess formation. Number 5. Poor hygiene. Poor hygiene can contribute to abscess formation, though many people with excellent hygiene still develop them. Symptoms of anal abscess. The symptoms of an anal abscess are usually quite noticeable and can be quite uncomfortable. Most people notice a painful, swollen lump near the anus, which may feel warm and tender to the touch. This pain often worsens when sitting, walking, or during bowel movements, making daily activities increasingly uncomfortable. As the infection progresses, the area around the abscess may become red and swollen, and the skin may feel tight or stretched. A persistent throbbing sensation is common, and the pain can sometimes radiate to surrounding areas, such as the buttocks or thighs. Some people describe it as sitting on a hot coal. Other symptoms can include fever, chills, and generally feeling unwell. Some people experience fatigue or malaise. If the abscess is large or deep, you might have difficulty having bowel movements or experience pain during urination. If the abscess begins to drain on its own, there may be a sudden release of foul-smelling pus, which can relieve pressure but also signal the need for immediate medical attention. Diagnosis of anal abscess. Diagnosing an anal abscess typically involves a physical examination by a doctor who will look for signs of swelling, redness, and tenderness in the anal region. In most cases, a visible lump or area of inflammation makes the diagnosis straightforward. The doctor may also ask about the onset and progression of symptoms, as well as any relevant medical history, such as previous infections or underlying conditions like Crohn's disease. For deeper or less obvious abscesses, additional diagnostic tools may be necessary. Imaging studies such as CT scans or MRI can help locate the abscess and assess its size and extent. These tools are particularly useful for identifying deeper infections, such as ischiorectal or supralevator abscesses, which may not be detectable through a standard physical exam. If systemic symptoms like fever or chills are present, blood tests may be performed to check for signs of infection, such as elevated white blood cell counts. In some cases, a sample of pus from the abscess may be taken and analyzed to identify the specific bacteria causing the infection, guiding antibiotic selection. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for anal abscess. The main treatment for an anal abscess is primarily surgical drainage, known as incision and drainage. The procedure typically involves making an incision in the abscess to allow the pus to drain out. This is usually done as soon as possible after diagnosis to prevent complications and provide relief. It is usually done under local anesthesia for surface abscesses, though deeper ones might require general anesthesia. After drainage, the wound is usually left open to heal from the inside out. This might sound counterintuitive, but it allows for constant drainage and prevents the abscess from reforming. Keeping the area clean and dry is essential to prevent reinfection. Daily dressing changes may be required, and patients are often advised to avoid heavy physical activity during the healing process. Antibiotics aren't always necessary for simple abscesses after drainage, but your doctor might prescribe them if you have certain risk factors or if the infection is particularly severe. People with diabetes, compromised immune systems, or heart valve problems usually need antibiotics. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage discomfort during recovery. Sitting in a warm sitz bath several times a day can also provide relief by reducing swelling and soothing the area. If the abscess is related to an underlying condition like Crohn's disease or a fistula, treating the root cause is essential to prevent recurrence. This may involve medications, dietary changes, or additional surgeries. Tips for fast healing. After treatment, proper wound care is essential to prevent recurrence and promote healing. Number 1. Take warm sitz baths regularly to promote healing and reduce discomfort. These can be done by sitting in a few inches of warm water for 10 to 15 minutes. Number 2. Maintain a high-fiber diet and stay hydrated to prevent constipation, which can aggravate the area and cause pain during bowel movements. Number 3. Avoid prolonged sitting or pressure on the affected area. Using a cushioned seat can help reduce discomfort. Number 4. Wear loose, breathable clothing to minimize irritation and allow air circulation around the wound. Potential complications. One of the most common complications of an anal abscess is the development of a fistula, which is an abnormal tunnel connecting the anal canal to the skin surface. About 50% of people who have an anal abscess will develop a fistula. If this happens, additional surgery might be needed to repair it. Other possible complications include recurrence of the abscess, spread of infection to nearby tissues, and in rare cases, systemic infection. This is why prompt treatment is so important. At the end, while dealing with an anal abscess can be uncomfortable and embarrassing, remember that it's a common medical condition that doctors are very familiar with treating. Don't let embarrassment prevent you from seeking treatment, as early intervention typically leads to better outcomes. Now, we want to hear from you. Have you or someone you know dealt with an anal abscess? What treatments or remedies helped the most during recovery? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.